Hello everyone, I'm Anastasia. Welcome back to another session of Fundamental of Nursing. As in the previous session, we've discussed about the healthcare services. In today's session, we are going to deal with a very small topic, that is the healthcare agencies. As we all know that healthcare services are being provided by the healthcare agencies. So in today's session, we will learn about what are the various healthcare agencies which are responsible for providing these services. As we all know that India is rich with many healthcare agencies which are responsible for providing services in order to promote health, prevent illness, provide curative services in order to reduce the morbidity as well as the mortality rate. So before we move on to this topic, first we will look at the definition of health. So what is health? Health is a state of complete physical, mental, social, spiritual, and emotional well-being and not merely absence of disease or infirmity. So here it means that if a person is healthy, he will be physically fit, mentally stable, emotionally as well as socially active. So here, if a patient is healthy, he will not be suffering from any kinds of diseases. So here, if a person is healthy, he will not be suffering from any kinds of diseases and he will be having a physically fit body, mentally stable mind, emotionally healthy as well as socially active. So now let's move on to the definition of the healthcare agencies. Here, what a healthcare agency is. A healthcare agency are the agencies which will be providing the healthcare services to the people in order to promote their health, prevent illness, and to provide a curative services to the people who are sick in order to prevent the morbidity as well as the mortality rate. Here, the healthcare agencies are responsible for providing the medical care, whereas the home care agencies are responsible for providing the non-medical care. So, as I've said that these healthcare agencies are responsible for providing services to the people. So here, as a healthcare agencies, they are responsible for providing the medical care. Whereas there is another agencies which is known as the home care agencies. This home care agencies will not be providing medical care, but they will be providing non-medical care. That is, they'll not be providing treatment only in the form of medicine, but they'll also be assisting the individual in order to perform their day-to-day activities. However, it is not necessary that these healthcare agencies should only provide medical care. There are some agencies which will also be providing the non-medical care, but this will be an additional service offer. Now we will look on the types of the healthcare agencies. The first one here is the hospital agencies. So hospital plays a major role in providing the healthcare services to the people. These hospitals can be the private or the governmental hospital. These hospitals can provide both the inpatient services as well as the outpatient services. So what is the inpatient services? The inpatient services are the healthcare services which is provided for the people who are suffering from a disease and who needs to stay in the hospital for further treatment. Whereas the outpatient services are the healthcare services which are provided for the people who need treatment but who does not need to stay in the hospital. There are also other governmental institutions which will be delivering these healthcare services, such as the primary health center, the community health center, the teaching hospital, taluk hospital, rural district, and the specialist hospital. So all these governmental institutions will also be playing a major role in providing the healthcare services to the people. The next is the daycare center. So what is this daycare center? These daycare centers are the centers which will be providing care for the infants as well as for the children whose parents are working. These daycare centers are responsible for providing care for the children, ranging from putting them to sleep, feeding them food, as well as engaging them in various other activities, such as playing, reading, which will help them in their developmental stage. So under these daycare centers, they also provide certain health insurance scheme for the employees, also known as the also known as the ESI or the Employee State Insurance. So here the employees who are working under this scheme will be getting certain benefits. The first one is the maternity benefits. These benefits are the ones which the women usually get during the pregnancy stage as well as during the months after they have delivered the baby. So here the woman will be getting the benefit of taking a long leave but still getting paid. The next is the medical care which will be given to the employee or to their children in terms of cash and kind. Suppose if the person is in his workplace and he has met with an accident where it has caused him an injury, this particular person this particular person will be getting the benefits of taking free leaves as well as being paid for the medical treatment. Suppose if the person has met with an accident in his workplace which has also led him to death, then under this scheme, the people or the children of the employee who was dependent on them will be getting the pension. Pension here means, so what is a pension? A pension here means it is a fund during an employee's employment years and from which payments are drawn in order to support the person's retirement years from work in the form of periodic payment. So that is all about the ESI or the Employee State Insurance. Moving on to the next, that is the Rehabilitation Center. What we will be doing in this rehabilitation center is that we will be assisting the client or the patient to restore back his normal health. So we as nurses must coordinate with the client activity and we must also ensure that the client is complying well with the treatment regimen which they are following. If only the patient is complying well with the treatment regimen which they are following, then only these people will be able to restore their health. So it is very important that we nurses must be very skillful and knowledgeable in order to help them promote their health. There is another agency which is known as the Home for the Aged People. Here what happens is that the nurses will be responsible for taking care of the aged people, which means the older people. Here the nurses will not only be providing physical care, but they'll also be providing the psychological care. As we know that when a person starts aging, he or she will become very dependent and will not be able to perform their own daily activities. So here in this Home for Aged People, the nurses will be providing them physical treatment, but they will be providing them both the physical and psychological treatment. So here in the Home for the Aged People, the nurses will not only be providing the medical treatment, but they will also be the one responsible for taking care of the physical as well as the psychological needs. The next agency is the nursing home and clinics. So these are the agencies which will be providing the medical care and the treatment only for the minor ailments. That is, they will only be providing care for the people who is suffering from any acute condition. The next one is the hospice. So what do you mean by hospice? Hospice is nothing but a healthcare services which is being provided for the people who cannot cure from the disease or for a person who are on the last stage of their life. So what does this agency provide? This agency provide a family-centered care. That is, they will be providing care to the patient at their own homes. As I've said, this care will be provided during the course of terminal illness. So here we will not only be providing the medical care, but we will also be providing the physiological as well as the spiritual care. As I've said that this services is only provided for the people who are on the last stage of life and who cannot cure themselves from that particular condition. So you guys might be thinking, then why are we still providing this service? We are still providing this services with the aim that we must try to manage the symptoms from further persisting. The next is the voluntary health agencies. So what are these voluntary health agencies? These agencies are the organization which is administered by the autonomous board who conducts programs to provide healthcare services, health education, as well as the related activities in order to improve the public health. So under this voluntary health agencies, there are the national voluntary agencies as well as the international voluntary agencies. The voluntary health agencies consist of the Indian Red Cross Society, of the Hind Kush Nivaran Sangh, of the Bharat Seva Samaj, and also the Indian Council for Child Welfare. Whereas the international voluntary agencies consist of Rockefeller Foundation, CARE, as well as Ford Foundation. Next is based on the indigenous system of medicines. Here there are four systems of medicines. The first one is the Ayurveda, the second is the Siddha, third Unani, and the fourth is the homeopathy. So what is this Ayurveda? Ayurveda is the one which follows the Ayurvedic system of medicine. So here these people who follow this system of medicine are based on the belief that health and wellness can be achieved through the sound body, mind as well as spirit. The Unani system of medicine is a great art and science. Here it aims to treat the human body, mind and the soul. This system is based on the Hippocratic theory of four humors, that is the blood, the phlegm, and the yellow and the black bile. The last one is the homeopathy. So this homeopathy is a medical system that believes that the body can cure by itself. So in this system, they will also be using the natural substances like plants and minerals because they believe that these will stimulate their healing process. And the last one here is the National Health Program. So these are the programs which will be organized in order to educate the people on how to promote their health. The first one here is the National Iodine Deficiency Disorder Control Program. So under this program, we will be educating the people on how to prevent themselves from these diseases and how to manage them. The second is the National Leprosy Eradication Program. The third is the National Mental Health Program. Here in this program, we will be educating the people on the importance of having a mental peace. As we all know that mental stress, anxiety, frustration can lead them to suffer from many mental illnesses. So in order to prevent them, we should educate them about the various stress management as well as the other coping mechanisms which they can follow on their day-to-day life in order to maintain a good mental status. The next is the National Program for Palliative Care. So what is this palliative care? Palliative care is a specialized medical care that focuses on providing the patient relief from pain and other symptoms of a serious illness, no matter what the diagnosis and the stage of disease they are in. Here, the team will try to improve their quality of life, not only of the patient, but also of the family members. The next is the National Oral Health Program, and the last one is the National Program for the Control of Blindness and Visual Impairment. So these programs are being conducted in order to educate the people on how to prevent as well as on how to manage them. So here we have come to the end of this topic whereby we have discussed about the various healthcare agencies and what are their functions. Here we've come to know that there are so many kinds of agencies which include the hospital agencies, the daycare centers, the home for the aged people, the nursing home and clinics, voluntary health agencies, indigenous system of medicine, and the last one which is the National Health Program. So we have come to know about these various agencies and what are the health services which they are providing to the people. I hope you guys have got a clear insight of this topic. We will be meeting you guys in another session whereby I will be dealing with further more topic which is more interesting. Till then, thank you. Bye.